Welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer Martin, your host for today's show. On our show, we bring you information about the agency's programs and services, as well as helpful tips to help you stay safe and healthy at home. Today, we are in the home of Lois Webster, a community member who has had services from Franklin County Home Health, and Annette Blanchard, our Hospice Manager. And I thank you both for being here today, and thank you, Lois, for allowing us into your home to share your story, your personal story with us. We're going to be talking about hospice, and we'll take some time later for Annette to give a brief background about what the hospice program is, but we want to start with learning about an individual story, Lois and her husband's story. So Annette, if you would start us off giving a background of how you met the family and how the services started, and then Lois can share some personal story with us.
Sure. I met Stan and Lois about 2 years ago after they had come home from rehab and were needing home health services. Stan was very weak and needing assist with personal care, skilled nursing for medication assessment, cardiac assessment, had some heart disease. See how he was coping with what was happening, and physical therapy for some exercises. And he had been a home care patient for about 2 years, and he wanted to be at home and remain there. And over that 2-year period, we saw Stan decline and lost weight, eating less, not really participating in home exercise program, just getting tired and recognizing for himself that his time in life may be limited. And then he had some episodes where he was in the hospital for dehydration and just malabsorption of things, and the family had called me to come over and talk to them at the hospital about where Stan should go from here. Should he go back and try rehab to see if he could gain strength and get nutritional status back, or was it time to pursue hospice? And knowing that he had been a patient and we had seen the decline, and knowing Lois and what Stan's wishes are, that he wanted to be at home, it was time to have hospice and have him come back home and be comfortable and have end-of-life services at home.
Okay. And so then you started bringing him home and
Yes.
shared with us how that experience was to come home.
We started hospice in the middle of July, just after he came home from the hospital. And the girls started coming 4 times a week. Mm-hmm. And by the time we had come to end of life, they were coming every day. Mm-hmm. But they're a wonderful organization. Everybody that has someone that they feel that they have to take care of, that's the way to go. It's home health and hospice. He had been sick for quite a while. When we went into the hospital the last time, they said, well, if you'll eat something, then you'll be able to go home. Well, he'd eat, but it didn't help. Mm-hmm. And the minute I brought him home, he wouldn't eat anymore. He didn't want to eat anymore. So Annette suggested we do hospice. And I knew some about it because we talked about it. But it was a little difficult for me at first to deal with the fact that I was dealing with end of life. Up until that time, probably, I kept thinking, maybe he'll have a turn. Mm-hmm. Maybe he'll just all of a sudden feel better, but he never did. Mm-hmm. He never came to that point that I could say, well, I think he's a whole lot better this week than he was last week. He didn't get any better. Yeah. And when the girls started coming every day, it was good, because that was a goal, to keep him clean and warm and fed when he wanted to be and not when he didn't want to, which was most of the time. But he still was reading 2 or 3 books a week, and sometimes he'd watch television, but he wasn't much of a television person anyway. But he would watch nature, because he loved, as you can see, he loved birds and animals. Most of the birds here he carved, and he was just always doing something. So as he got weaker, he really resented that with himself. You know, he didn't blame anyone or anything. He knew that he was getting
weaker.
to the point where he wasn't able to do what he wanted to do. And
I think he was okay with that, being at home. Whereas
yes, he was.
if he wasn't at home, he
wasn't happy.
He wasn't happy.
He was not happy at rehab or hospital or anywhere. He just didn't want to be there.
Yeah.
Well, you consider for the family, there's so many things to consider, but for the dying patient, you can talk about this a little bit, and that the stages you go through to recognize that this is changing and you know, something new to get used to.
Yeah, and it is a process. It's not a decision that happens overnight. Like it's a process. It's recognizing that you're tired and you don't have the energy and you don't have the appetite, and I don't want to pursue anything aggressive, and I just want to be surrounded by my family and have people coming in to help keep me comfortable. It's really a gift that
Yes.
you guys were able to honor that for him at home.
And we've all been happy with that. All of us, all 5 of us, 4 children, and well, I have 3 grandchildren, and they were all on board with everything that we did. So that was good. There was no discussing any of it. It just fell into place.
And I think sometimes people struggle with how much treatment do I do? How long do I keep going? And they do it for their families and they do it for their loved one, and even though they may not want to do it anymore. And the only way to get by that is to talk about it and to experience it and say, I'm really tired of going to the hospital and getting chemo or getting treatment, and so you have to start having those conversations ahead of time.
And the hospice program it's a wonderful program. Annette came and she said it's time to put him on hospice. Well, I had talked with Annette before about hospice, but I didn't fully understand just how much they would do. And when she said, you don't have to make decisions now, and that was like a weight was lifted.
Decisions
off my
about treating
shoulders.
him and aggressive.
Yes, about
and
treating
just,
him and so forth.
Yeah.
And when I could call any time that I needed help, and I did quite a few times, because I knew where we were going, and it was hard for me to start doing final things. It was very difficult, but these girls helped me along with that and made me understand what we were doing and why and so forth.
It can be overwhelming to take
it is
all that while
overwhelming.
you have an
It
emotional
is.
response. Yeah.
I had some help. My younger daughter she would come early in the morning and help me get him up, because he got to the point where I couldn't lift on him. Even though he was thin, he was heavy.
Yeah.
He was a big, bony man, and I couldn't handle him too well. And then my next middle daughter would come at night and check to see that everything was okay and that I had him in bed and so forth, because he didn't stay up very long. He went to bed by 8 o'clock at night. And most nights he slept through, but then after we started the hospice, he didn't. He was up a lot of nights and didn't know where he was and who he was or where I was or what was going on and so forth. And then we started the drugs that he needed to take. And that was difficult for me, because I was a nurse. I did an 18-month program at the Catherine Booth Hospital in Montreal. And I was taught to save lives, not to help them along or whatever. So that part was difficult for me, to give him medications that I knew were going to just keep him quiet and out of pain. And so that was a little bit hard for me to start, wasn't it? But then I did manage it.
I don't think that's unique. I mean, it is something that's hard for all of us to understand,
Yes.
and you can talk with us some more about that as we talk about medications and what the hospice program does.
It is hard to understand.
It's hard to let go,
because
and
I made an oath, took a vow to not do anything deleterious or anything that would keep people alive when they shouldn't be, when they need to go, and he needed to go. He was, like he asked me, I think maybe it was 2 to 3 weeks before he passed away, if I would stay here. And I hadn't even given that a thought.
If you would stay in the house. Yeah.
He said, are you going to be able to stay here? And I said, yes, I think so, at least until I can't anymore.
Okay.
And also he said, will you keep Lily? And I said, yes.
Is that your cat?
He thought the world of that cat.
Yes, yeah.
And she spent most of her time, we put the hospital bed out here, and she spent most of her time on that bed with him. Anyway, but it was, I said, a most positive experience to go through this. I was able to do it, even though it was hard, but my kids were wonderful too. I wasn't sleeping very well, but then that kind of straightened out too. But I was most impressed with this hospice program. At the end, the girls were coming every day, and we needed them because there was a lot of linens and so forth to be washed, and I was managing that. Usually the girls would fold at night or in the morning, but they were just wonderful. And then, up until that time, I'd never had anyone come and stay, while I went out somewhere. And they said, well, you can call anytime. And they were the most wonderful
volunteers,
people.
Volunteers, yeah.
They were just wonderful. The first one that came was Chris.
Sweeney.
Yes, Chris Sweeney. And of course Stan's bed was here, and he didn't know just how this was going to work. Well, she walked right over to the bed and started to talk to him. And when I came home, they were still talking. And usually he'd go right to sleep. If anybody came in, if he didn't want to talk, he went to sleep. But they were still talking. And then the gentleman, Mr. Lambert, he was wonderful. And 2 or 3 others, I can't recall all their names right now, but I know who they were, and they were just wonderful. And they kept him busy when I was gone. He didn't just lay there and sleep. When I was home, he would wake up and he would talk with me, but he was extremely deaf. So that was difficult. And Christine brought him a board too.
The white.
The white board. So I wrote something he couldn't hear me say, and I wrote it down. And he looked at it and he said, well, what does it say? I said, I'm sorry. I'll be more careful.
That's great.
But they were just, I don't know how anyone keeps someone that was in his condition home alone. And everywhere I go or I speak to anybody, I say, look, I had home health right from the beginning and right to the end. And they were wonderful. Just wonderful people, and just good people. I've heard from quite a few of them since, which is nice. And I just know they're there. And when I come to that point, that's who I want to take care of me. I hope they're all the same ones.
You mentioned home health was with you from the beginning. Before the hospice program, what kind of services did you and or Stanley receive from home health?
Home health were here 3 times a week until we started hospice.
Okay.
Home health aid for bathing, skilled nursing.
He knew what he was reading, and he did have times in the morning where he didn't know what he was, where he was, or he'd forgotten. When we came home from rehab, he didn't tell me for quite a while, but he said, when they brought me home that day from the place I was in St. Albans, and I said, yes, rehab, yes, he said, I didn't know that I'd ever been in this house. And I thought, oh my, where are we going now? Because we'd been here 60 years. But he didn't remember. And then times it would come back to him. And I'd say, well, don't you remember building the cupboard? And he'd think a minute, and then he'd say, well, yes, I do remember that. And he said, did I build that? I said, oh gosh, yes. Well, then one day he said, did I do that after I retired or before? I said, oh, you did that when you were farming. And like he did the cupboards in the kitchen and anything that I wanted made, I just asked about it and he'd do it. He would build things.
I think for Stan and for Lois and the family, it was determining when it was time to move from home care to hospice. He was an elderly gentleman. He didn't have a cancer diagnosis. He didn't have the sudden changes in status when it was very easy to determine. So it was just listening and recognizes the changes in his body, that his heart was getting tired. He was physically getting weaker. He wasn't eating. He wasn't absorbing what he was eating. And it was, do we keep doing the aggressive measures? Do we keep going to the hospital and coming home? And he didn't want that.
No,
he wanted to be at home. He wanted to be with Lois. He wanted to be comfortable. And it
home
was,
is, like you said, he may
transition.
have had times where he had to ask, but it's home and it's a familiar setting.
That's
and you
what
were
he
here,
wanted,
and you
where
were
he wanted to be. He lived here as a child,
Wow.
and this was where he wanted to be.
And he knew that he
knew.
knew that the end was coming, and he wanted to be comfortable. And
And that was
did he
all.
want to do exercises or
No, he
push
didn't.
himself to eat or drink? No, he
did.
just wanted to be happy and read
Yeah.
and be with Lois and be comfortable.
Liza would say, "Shall we do a few exercises this morning?" And he'd say, "Okay." And she'd have him lift his foot, and I'd see him go, just barely lift it off the floor. And I said, "I think you're supposed to lift it harder." "Oh, yeah." He'd just look at me and say, you could stay out of this. Liza's doing this. And then she'd go over to the sink, and they'd stand with their hands. And Stan wore a size 12 shoe, and Liza wore a shoe about this big, and she's standing there lifting her little foot off the floor, and he'd just barely move his foot up, So she'd say, "When will this be over? I don't want to do this any longer." But he was pretty cooperative about anything the girls wanted to try or do or think would help. But anyway, and they brought everything from home health to use, most of the things.
Yeah.
And it like I say, it was just a very positive all the way through. I never heard him complain about anything that the girls suggested or anything.
Yeah. And when we had a hospice, we got the hospital bed.
That was wonderful,
and,
yes.
Social work was in visiting with Lois and the LNAs and the volunteers. And
Oh, gosh, yes.
we were a team. And
Yes, certainly a wonderful team. I have said, and of course the morning that he died, I was supposed to call Annette, but Annette was at the hospital with her mother, wasn't it? And anyway, now I can't think of the girl's name that came. She was from up Enosburg way, not Jean.
Terry. Terry?
Terry.
I think
Terry.
it was Terry.
I think that was it.
Yeah.
I mean, I called her at 6 o'clock in the morning. I knew he was gone when I got up at 5:30, but I thought, I can't bear to call somebody out at 5:30 in the morning. Is a half an hour going to make a big difference, My daughter was here with me, and we called my son and my other daughters. And so when she came, she just took over. She said, "If I need anything or want anything, I'll ask you." And we were fine. And I knew where all the drugs were. And got those all taken care of. And it was just made very easy for me.
What I thought was wonderful is you had the calling hours, visiting hours, calling hours here at the house for Stan, and that was just a nice ending to a wonderful life.
It was very positive, and so many people have called me. And it was hot that day, remember?
Yep.
But we had the doors open, and there was an air conditioner out in that other room. But between 1 and 4, there were 115 people here. And that was, Stan knew everybody in town. And he loved this town. And served on just about every place there was to serve. He did it.
So, again, thank you for sharing your experience, a very personal
most
experience,
welcome.
and Franklin County Home Health is glad to be there.
So good.
Yeah.
And I have told women my age that one friend that I've been friends with for, almost 60 years. And I said, her husband died 6 years ago, so she didn't have any. And I said, I'm so sorry that you didn't have, when Harold died, that you didn't have this help, because it made such a difference. Because I can remember the night we came home thinking, how am I going to do this? But they had reassured me before that it could happen. It would be all right.
Yeah, and I think sharing your story is so important, because as you found yourself in the situation of what do I do, what's out there, and there's so many people, as much as we try to share the hospice story, that we still, it's a lot to take in at that time of your life, and we're so grateful that you can share that story with us today, so that we help let people know there is an answer, and someone who can be there to help you.
Yes, there is. And so many people say, I couldn't do that. I can't look after it.
You don't have to do it alone.
You can do it, but you have this service, and it is wonderful.
Thank you. So let's talk a little more about the service, Annette, and certainly got the personal side of it from Lois, but tell us, recap what hospice is, a little bit about the background of how it came to be in our country. So we'll start there. What is hospice?
Okay. Hospice is a program for people who are at the end of life, and originally hospice originated in England, and it was a program over in England for people who were at end of life and suffering from a terminal illness, and eventually it worked its way over to the United States. In the 1980s is when it started to gain more focus in the United States as people were dying in the hospital, attached to machines and equipment, and not having peaceful deaths. And it was really a movement to try to get people back at home at end of life, and recognizing that they are at the end of their life, and they don't want to continue to pursue aggressive measures, and they want to be home, and they want to be with their loved ones, and they want to be comfortable. And any diagnosis is appropriate for a hospice if the physician and the hospice program feel that the patient has a limited prognosis.
So you often hear people with cancer, but it can be other conditions that folks
Correct. Cancer, end-stage lung disease, end-stage heart disease, just kind of a failure to thrive in someone who's 95 years old and they're just tired and they don't want to eat and drink anymore, and their body is just worn out, and they're ready to let go. And sometimes that's a difficult transition for families to make, to recognize that maybe they are really reaching end of life, and it's time to pull back a little bit and get them supports and allow them to be comfortable.
And that dying is a part of the experience.
Dying is a part of life, and it's part of the experience, and it happens to all of us.
Everybody.
Yeah. So we've been talking about hospice in the home. You receive services here in the comfort of your home, and that's what Franklin County Home Health strives to do. But can the program be provided to people who are not in home?
We can. We have provided hospice care to patients who live in community care homes, in skilled nursing facilities. We have provided hospice care to patients in the hospital.
And how is it paid for? I guess we all have to ask.
Medicare certainly pays for hospice. Most private insurances, Medicaid, and some donated private funds also pay for hospice.
That's why our agency will do some fundraising to help raise money for needs that we might not get covered through other services. Yes. But what can you talk to us more about what bereavement is and what services are offered?
Our goal in taking care of any patient and his family is recognizing that this is a difficult time for the family and the person who's dying, and really looking at how it's going to impact the family after the person dies, and especially for people like Lois who've been married for 60 years, and that's a huge loss, and we want to, and we understand that following up with the family after the person dies is as important as while we're taking care of the patient.
The care continues.
And it's important for us too, because we want to make sure that our families are okay and that they're doing as well as they can, and they've been a part of our lives, so we want to make sure that they're doing
I have one daughter, my second, Marilyn. You've met Marilyn. Well, she was very close to her father. The other two girls are too, but that relationship was a whole different thing. They were she was very much like her father, his same work ethics and a to-do list and all that, and she's having a very hard time because...
And I think it was hard for the kids as it was happening. You saw him and you saw the decline, and so to get them to understand that it was time for hospice and time to let Dad go.
Yes,
that
yes.
was
and then my son just lives up back, and he was here a lot. He came a lot.
Yeah.
And when he was here this morning, and I said, well, I've got to go, Howard. I have someone coming to do some interviewing and talking. And he said, who if? And I said, well, from Home Health, about hospice. Oh, he said, tell them how wonderful I thought they were. He was all for everything that we did. So
it makes me think about another topic I want to bring up about planning. And having gone through this experience, are your children trying to talk about what they would like at this time in their life, or do you think that's going to come up, and how had this experience might affect how they view end of life and needs? Should they get there in their
Yes, they do know.
Yeah. So you can have those conversations now.
We both, as soon as it was when we started care, we both did.
Advanced directives.
Yeah.
So those are all in place. So the kids know exactly what to do. But yes.
Talk about that.
But if I were ill, they would know that.
Your wishes.
It would be my wishes to be here as long as I could.
It's an important conversation to have with family and loved ones, and talk about wishes at end of life, or if there's a sudden event that happens and you didn't think you were at end of life and now you are. And it's a conversation that you have to keep having with family as you get older and as you start to decline. So a lot of people don't like to talk about death and dying. But it's part of life, and it's something we should always be discussing.
Does Franklin County Home Health have tools or a system to help people make this conversation? What kind of questions should we be asking? And
we do. We have a wonderful pamphlet and a program called Start the Conversation that we can give out to families, and we've done some speaking around the county on having that conversation and how to have that conversation with your loved one and your family. And we're always available for questions if you're not sure how to approach the conversation.
My question is there a right time to consider hospice care?
Is there a right time to discuss hospice care? It's always better to have those conversations earlier rather than later, and to recognize that at some point in all our lives we're going to need to discuss, where do we want to end our life? Do we want to be at home, and who do we want to be surrounded by, and really have it be part of the plan.
Very good. So we've been talking about hospice, volunteer services. Can you touch base a little bit more about how that works? Lois had many volunteers she mentioned here, and that sounded very helpful. How's that system work?
Yes. They were wonderful.
Our volunteers go through a 12-week training program where they learn about death and dying and how to help a family who is going through this. And then we try to match the volunteers with the patients and the families that we have. Many of our volunteers come to us because they've had a prior experience with hospice, and they value that and recognize that and want to help other people. It's a wonderful opportunity for them to work with patients and families, and they are our eyes and ears for giving us back information.
Right, it's all a team. So
we work as a team.
And you're here in Georgia, and we have a need for volunteers and staff throughout the entire county, so from the other end in Montgomery and Richford area all the way to this side of Georgia, so we're always looking for people who can help you in all of those areas.
You do just all Franklin County?
All of Franklin County, yeah.
Very good. Anything you'd like to add before I wrap up today about hospice care and then the situation here?
Well, I thank Lois for being willing to sit with us, and thank you all for listening, and if you have any questions about hospice, don't hesitate to call us at Franklin County Home Health, and we'll be happy to answer them.
Absolutely. So again, I'm Jennifer Martin, and I've been talking with Annette Blanchard, our Hospice Manager, and Lois Webster, a family member who would receive services from hospice. And we've been talking today about Franklin County Home Health Agency's hospice program. As Annette mentioned, we are available by phone. You can also find information on our website at www.hcah.org. www.fchha.org to learn more about what we've been talking about today. We also encourage you to talk with your family members and your doctor about programs you may need at home. Again, it's Franklin County Home Health Agency, and our phone number is 527-7531, and we welcome your questions. And thank you both for being here today and letting us come to your beautiful home and having this discussion. We do appreciate it. So thank you for watching, and be well.